Medicaid work requirements are policies that make health coverage conditional on work or other activities. They were introduced by the Trump administration and supported by some Republican lawmakers, but they have faced legal challenges and criticism from experts and advocates. In this section, we will explore how Medicaid work requirements can result in substantial coverage loss, especially among vulnerable groups such as former prisoners who face barriers to employment and health care access. Medicaid work requirements typically apply to adults who are not disabled, elderly, pregnant, or caring for children or other dependents. They have to report a certain number of hours per month of work, education, training, volunteering, or other activities. If they fail to do so, they can lose their Medicaid benefits. But these requirements are not effective at increasing employment or income. In fact, they can have the opposite effect. According to a study by the Center on Budget and Policy Priorities, Medicaid work requirements in Arkansas led to more than 18,000 people losing their health coverage, and most of them were working or eligible for an exemption, but they did not report their status due to confusion, lack of awareness, or administrative hurdles. Losing health coverage can have serious consequences for people's health and well-being. It can make it harder for them to access preventive care, chronic disease management, mental health services, and substance use treatment. It can also increase their financial stress and medical debt. These consequences are especially severe for former prisoners, who are among the most vulnerable and marginalized populations in the U.S. Former prisoners face many challenges in finding and keeping a job, such as stigma, discrimination, lack of education and skills, and legal restrictions. They also have higher rates of physical and mental health problems than the general population, such as HIV/AIDS, hepatitis C, diabetes, depression, and post-traumatic stress disorder. Medicaid is a lifeline for many former prisoners who would otherwise be uninsured and unable to afford health care. Medicaid can help them address their health needs, reduce recidivism, and improve their chances of reintegration into society. But Medicaid work requirements can put this lifeline at risk. For example, a former prisoner who is looking for a job but cannot find one may lose his Medicaid coverage if he does not meet the work requirement. Or a former prisoner who is working but has an unstable or irregular schedule may lose his Medicaid coverage if he does not report his hours correctly or on time. Or a former prisoner who is enrolled in a drug treatment program but misses a session due to transportation or childcare issues may lose his Medicaid coverage if he does not document his participation. These scenarios are not hypothetical. They are based on real experiences of people who have been affected by Medicaid work requirements in states that have implemented them. And they show how these policies can harm the most vulnerable and undermine the goals of Medicaid. Medicaid work requirements are not only ineffective and harmful, but also illegal. The Biden administration has withdrawn the approvals of these waivers, and the Supreme Court has dismissed the pending lawsuits against them. But some states are still pursuing these policies or challenging the withdrawal decisions in court. We urge you to join us in opposing Medicaid work requirements and supporting policies that expand access to health care for all people, especially those who need it most.